I reckon Guy Martin did. He just wore it down.
Everyone, my name is Martin Trainer and I have the honour of serving as Chair of Loughborough Town Deal Board. I'm delighted to welcome all here today for the official unveiling of the Hope Bell. It's wonderful to see so many of you gathered to celebrate this remarkable new landmark. The Hope Bell is not only a striking piece of public art, it is a symbol of unity, remembrance and pride for our community, which I am confident will resonate with people across the town, the borough and beyond. This project has been possible through Loughborough Town Deal, which secured £16.9 million of government funding. The Hope Bell is part of the Lanes and Links initiative and is one of 11 transformative projects here in Loughborough. Together, these projects are helping to revitalise our town centre, enhancing green spaces, improving connectivity to the new, right the way through to the new digital skills hub being built at Loughborough University. Today is a celebration of progress, partnership and the enduring spirit of our community. The Hope Bell also stands as a tribute to the dedication of key workers, public service and the resilience of our communities. In a moment we will hear from several speakers. Councillor Malju, who is the leader of Charnwood Borough Council, Dr. Zhang Zhu, who is the Deputy Medical Director of University Hospitals of Leicester NHS Trust, Paula Clark, who is the Chair of the Leicestershire and Rutland Integrated Care Board, Dr. Jiva Sander, Member of Parliament for Loughborough, and Karen Foswick from John Store at Charnwood. Following the speeches, there will be a pause for a moment of reflection before the bell is rung. So it now gives me great pleasure to invite Councillor Jill Mayer to come up and say a few words.
Hope Bell marks a time when the world changed almost overnight. Every one of us was affected. For many, it was a time of deep concern, worry for the health of loved ones, uncertainty about jobs and livelihoods, and anxiety over the long-term effects on our young people and their education. We were forced to stay apart, and that sense of separation weighed heavily on us. Today's date is especially poignant. It marks 5 years since the easing of restrictions following the first national lockdown. An event like this would have been unimaginable back then, and yet here we are together again. While those times were undeniably difficult, they also revealed extraordinary stories of courage, compassion and resilience. The NHS shone like the beacon it has always been. Health professionals across the country and right here in Charnwood demonstrated relentless dedication and selflessness in caring for others. It is fitting that we unveil the Hope Bell today on the eve of the NHS's 77th anniversary. I'm especially pleased to welcome colleagues from the NHS who are here with us today to mark this occasion. But the Hope Bell also honours the many others who played vital roles, our emergency services, police, fire and ambulance crews, and the countless key workers who kept our communities functioning. Council staff adapted rapidly to new ways of working, helping us to coordinate local support efforts. Our partners at Serco ensured that waste collections were never missed, keeping our borough clean and safe. At the council, we adapted services to support the vulnerable and worked with others to distribute parcels and carry out welfare checks. We issued vital business grants to support the local economy and even hosted a vaccination centre. We also work closely with Loughborough University, Loughborough College and other local institutions to protect public health and maintain essential services. The pandemic reminded us of something we've always known in Charnwood. In times of crisis, our community stands strong. Strangers become friends, neighbours looked out for one another. Our incredible voluntary and charity sector stepped up in remarkable ways playing a central role in both the response and the recovery. It feels like a different time, and it was. The Hope Bell is here to ensure we never forget. It marks not only the events of that time, but the spirit of the people of Charnwood. It honours the sacrifices made and the unity we found in adversity. Its designs reflect that journey, the pillars leaning inwards to symbolise people coming together, something we all longed for during the pandemic. The Hope Bell also celebrates Loughborough's unique bell-making heritage. Our town is home to John Taylor & Co., the UK's only remaining bell foundry, a remarkable institution that continues to uphold centuries of old skill. I'm pleased that Loughborough Town Deal has been able to support the foundry and help preserve this important part of our heritage. It's fitting that the Hope Bell stands here in Queen's Park, close to the Carillon Tower, where Taylor bells still ring out. This location ensures that the Hope Bell is accessible to all, a lasting reminder of our shared experience and our shared strength. It is a place where people can come together and reflect, perhaps to remember loved ones. I would like to thank the Loughborough Town Deal for their support in making this project a reality. The Hope Bell is part of the Whiter Lanes and Links initiative led by the council to better connect this beautiful award-winning park with the town centre. Thank you once again for being here today. I would especially like to thank the Deputy Mayor of Charnwood for joining us. And now it is my pleasure to hand over to Dr. Gang Zhu, Deputy Medical Director at University Hospitals of Leicester NHS Trust. Thank you.
My name is Gang. I'm a kidney doctor. I work at University Hospital Leicester. I've been working in University Hospital Leicester for the last 20-25 years. I live down in Syston, down at A6. Actually, my daughter learned to swim just up the leisure centre here, so I come up to Loughborough quite a lot. I think this looks really magnificent, actually. I was just speaking to a few members of the team here in the corner who built it. I think it's a really important piece of artwork, but also a really important memorial, actually. Because time goes really quickly. I think, as we heard from the previous speaker, that actually having this gathering 5 years ago was unimaginable, but actually a lot of us probably have forgotten what it was like back then. And reflecting back on the events of 5 years ago, I have some really vivid memories of cycling to work, because I enjoy cycling, and there were some interesting bits of going down London roads with no traffic whatsoever. That was a good bit. But then when you got to work, I personally had a palpable feeling of fear, actually. This was right at the beginning. I remember walking onto the intensive care unit, which had been expanded, looking at a bay which used to be where we teach medical students, and seeing patients there on ventilators. And then I remember looking at the masks we all had to wear, and then we had this process set up where you had to stand in a corner. Someone had to watch you wash your hands, so you were doing it properly. Someone had to watch you take off your scrubs to make sure you didn't contaminate everyone. And I can just remember one point thinking, is this a film? What is actually going on? But actually the most remarkable thing in the hospital was, although I felt that fear, and I'm pretty sure every one of my colleagues, everyone in the hospital, in the community felt that, none of that really came through, because the one focus I think everyone had was that we had to get the work done. We have to make sure we try to keep on delivering care. And what made that possible actually was looking in the community. Was when you got home, you turned on the news, you heard the clapping, you saw how dedicated everyone was to trying to do their bit. So people staying away, and that impact that must have had on everyone. You know, it impacted on me. Impacted on, it would have impacted on families, the isolations, the mental health, the small businesses, all the big businesses of not knowing, you know, when the thing's going to return to normal. So those things are really important to remember. And then the sacrifice I think everyone will have felt. I know personally of colleagues who are not here today because of COVID. I know of patients who I've looked after for 5 or 10 years prior to that who are not here today because of COVID, and thinking back to myself, well, could I have done something different? I mean, they were here, and I'm sure everyone here will have those memories. But I think the importance of this bell actually is to remind us if we all come together, we can do some really amazing things. And the NHS 10-year plan has just been published. I think there's some really exciting things we can do to make healthcare, to make the NHS more accessible, to make it more digital. And I think working together, I'm really proud actually to have worked in UHL for so long. I'm really proud to be here. Everyone at UHL loves the work they do. And I'm really committed to making sure going forwards for the next 25, 50, 75 years that we continue to evolve the NHS to serve everyone here, because we're all going to need to use the NHS at some point, and we all have it to do the best thing possible. So thank you very much. I'll hand over to Paula.
Thanks, gang. I think nothing quite brings it home to us around what happened 5 years ago than actually hearing a story from somebody who was on the front line. So thanks, gang, for that, because it's very personal and very, very moving to hear your experience. So it's a privilege to be here today as we gather for such an important occasion. And it's both poignant, but it's also one of great pride. The unveiling of the Hope Bell is that occasion. It's a reminder of a time that tested us all, a time of unprecedented challenge, loss, but ultimately incredible resilience, and that's a word that a lot of the other speakers are using, because we showed our resilience during that time. Despite those difficult times that we found ourselves facing, it's impossible to overstate the debt that we owe our NHS staff and the work that they did for the communities here in Charnwood. When the world around us seemed to stop, the NHS pressed on, standing on the front lines day after day, doing what they do best in terms of caring for their communities. In Charnwood, one of the biggest out-of-hospital contributions were the vaccination services. We've already heard they were at the council offices, they were at Emmanuel Hall, Salvation Army and lots of other sites. And it wasn't just NHS staff manning those vaccination centres. We also had a fantastic army of volunteers that helped. And also for those who couldn't get to the vaccination centres, we had roving units that went out to them. Our GP and community services, they continue to work for our patients under very difficult conditions. And that was to keep them safe, but it made the usual face-to-face interactions so hard. And I think everybody, patients and staff, found that very difficult. The Hope Bell, therefore, is a testament to their extraordinary service. It's a permanent thank you to every single member of the NHS and the incredible volunteers who also helped and gave so much during the pandemic. Their professionalism, their compassion and their endurance were and truly remain awe-inspiring. Thank you. And I'll hand over to Jeevan, who's going to talk next.
Thank you and good morning, everybody. As I stand here today, I remember that during the pandemic it showed the best of us. We showed as a community, as a country, that we are best when we have a common sense of purpose, of connection, and rooted in each other is our well-being. And that indeed was our strength at that moment. That is where our strength is born out of. I think of three things in particular. The first being each and every one of us. The individual connections we missed, the loneliness that we all felt. Missing marriages, missing births, missing conversations. The distinct set of loneliness that we all gave up to protect people we would never know, never meet, and never speak to. We did that because as a nation and as a community we knew that our well-being is rooted in one another. I think secondly of all the nurses, of all the doctors who put themselves on the line for a disease they knew could kill them, a disease that did kill them. All of those who gave their lives at that moment to keep us all safe. And finally, and I think most of all, of those who died, but also most importantly their families, who never got to go to their funerals, who said goodbye over Zoom. And I remember the horrors of that lockdown in the winter of 2020, and the thousands and thousands who died. And there were loved ones who never got to say goodbye, but they did so, and they never went, because they wanted to protect each and every one of us. We are stronger as a community, and we are stronger as a country when we recognise that our common strength is founded in each other, our well-being, our flourishing, our connection, our unity. So as we look on this bell today, yes, it is a sign of remembrance, yes, it is about those who have gone, but it's also for us a reminder and a guide for how we should act going forward. This is an angrier and more divided time. We understand each other less and less. This should be a reminder that we are our best when we understand each other, when we share a common purpose. That is how we are stronger. Thank you all very much today. Thank you so much to everyone who's put this on today. I'll hand over now to Karen Frostick. Thank you all.
Hello, I'm Karen and I'm the director of John Storer Charnwood. I remember really distinctly 5 years ago in early March having a telephone call with Verity saying, if this all goes down, do you think we could come to John Storer and do like a bit of a community response? Not did we ever imagine what that going down would actually look like. So in fact, within a week, I think we were already setting up bubbles, socially distanced offices so that we could welcome people from the wider community, from other community voluntary sector workers and agencies. We had people coming in from all sorts of agencies saying that they would like to help. So what were we able to achieve? Well, we quite quickly, from wondering whether we should start to stock in a few tins of bean, we soon moved towards delivering 660 households a week with food parcels, and they were to families and households that were told to shield. We also had families that were vulnerable and were facing food insecurity, made worse by the restrictions and lack of support through their own normal networks, or in fact highlighted that some people didn't in fact have networks, and that was also highlighted very sadly, that people didn't have people that they could call on and ask to shop for them. So we knew we'd got a lot of support through all of our volunteers that were working with all the agencies together. So what could we do? We were kind of really busily trying to work out how we could recruit people to provide befriending through the telephone to those people that were facing isolation. How can we get people's shopping out to them for those that we can't deliver parcels to? There was this equally, if not greater amount of people who just needed help with their shopping. So we came across a really exuberant group of young volunteers from the university who had everything we had apart from concerns about risk assessments and how we can do it safely. They just wanted to do it. So we were a bit like, okay, we'll risk assess in the background, you carry on. And they were just amazing. They recruited hundreds of volunteers to start what was called Loughborough Against Students Against Corona, or LAC, Loughborough Against Corona as they became known, and they were just remarkable. So other than the things that we were actually supporting, some of the really, we had actually some really sort of special moments in amongst all of the, sadness and concern for others. And a memory just to recall was a day when Greg's rang and said, we've got quite a few donuts that need using up. Do you think you could use them? Yeah, we've got 660 parcels a week to deliver. Of course we can use donuts. Not what we didn't expect for there to be a lorry with 9,000 donuts around. At a time when we couldn't talk to people, be next to people. So we had quite a remarkable, probably Loughborough's only drive-through donut shop around John Storer, where we had racks and racks of donuts. And people one by one drove in a car from the ambulance service, local specialist schools who were still open, care homes. We had people from the fire brigade, police, everybody had a donut, and they were pretty remarkable. Quite a lovely, sweet moment in what really was quite a sad time. So what about the legacy, and what does that look like for us now? When we were working in partnership, we've always known that we work so well together when we work in partnership with the local authority, but also within the sector. We know that we can do remarkable things, and so that's remained. We're still very, very dedicated to the power of partnership and what that can achieve. And from the work that we did during the time that we needed to provide that COVID support, we did recognise that, again, these very vulnerable households that actually didn't really have the networks that many people benefited from having, albeit kind of remotely. And so we've continued to provide support to a lot of those people in those same communities. We continue to work in partnership with other agencies. The Bridge East Midlands actually sold their building and have moved into John Storer, so we can work more directly together, and that's having great results. But also, from the food bank, we realised there was a need for a second layer of food insecurity support, and from that we developed a new service called Your Store, which still to today is still very busy and very much needed, and still very centred in the support that was created out of what it felt like at the time a real crisis. So I think we must hold on to the sad memories, because we mustn't ever forget that, but we should also hold on to exactly what we can achieve as a community and quite how amazingly strong we are in Charnwood. So thank you to everybody.
Thank you for that.